Hello friends, welcome back. My name is Dr. Vijay Bhatia. Today we are going to talk about what are positive symptoms of psychosis and schizophrenia. Positive symptoms of psychosis and schizophrenia include delusions, hallucinations, distortions or exaggerations in language and communication, disorganized speech, disorganized behavior, catatonic behavior, and agitation. What is a delusion? This is a famous quote from Thomas Paine. To argue with a person who has renounced the use of reason is like administering medicine to the dead. What does it mean? Delusion is a belief that is firmly held on inadequate grounds, is not affected by rational argument or evidence to the contrary, and is not a conventional belief that the person might be expected to hold given his educational and cultural background. So it is a belief, and you cannot argue with the person who is holding that belief, and there is no reason to believe in that. So that is a delusion, and there can be a number of different themes. What is hallucination? Hallucination is a percept experienced in the absence of an external stimulus to the sense organ and with a similar quality to a true percept. A hallucination is experienced as originating in the outside world or within one's own body, like a percept, and not within the mind, like imagery. So if the person is walking along the road on his own in a dark or evening, the person might see some faces which to him may not appear any different, as if the person is having or seeing something in real. This is a picture of catatonia, because it's called waxy flexibility. The reason is the person has behave or feel the muscle in a way that if I move this arm to any position, it will stay in that position for long periods of time. And if I move the leg to another position, it will stay in that. And it is like a wax. I can move it to any direction or any shape, and it will stay there. And this happens in catatonic schizophrenia and other neurological conditions. But this symptom is not present in all types of schizophrenia. There is agitated behavior. Delusions, as we understood, are the false beliefs that are strongly held. And in schizophrenia, it normally involves misinterpretation of perceptions or experiences. The most common type of a delusion in schizophrenia is persecutory, but it may include a variety of themes, including referential, that is, erroneously thinking that something refers to oneself. So if somebody is watching a television and they are discussing something, the person will think that they are talking about me. Persecutory means that the person is threatened by somebody with a threat to end his life or kill themselves. So person believes that there is outside agencies after him. A person may have some somatic delusions, that is the bodily delusions, that they can't move their hand or they can't stop moving their leg. So it is belief that affects the body, or it can be religious belief, and they believe that they are a saint or somebody with special abilities, and they have come to the earth with some kind of mission. Or they can be grandiose, that they have special abilities and skills that other people can't do, and that has been gifted to them, and they're very grandiose in their thinking. Hallucinations, they are perceptions without stimulus, and they may occur in any sensory modality. However, in schizophrenia, the most common is auditory hallucinations, and especially the third person auditory hallucinations, when the person believes that more than two people are talking among themselves about the person, or he may hear the running commentary. Somebody is giving a running commentary on his behavior, on his actions. There may be visual hallucinations, but this will suspect some kind of organic, either infections or illicit drug use. There may be olfactory hallucinations, that person can smell something that is not there. Gustatory, they can taste something which is not there. Tactile hallucination, person is thinking that somebody is touching them, having sex with them, or their body is there's underneath their skin, or something is on their skin or inside their body, where they can feel the pain or sensations or movements inside. It's normally to do with the skin and the sensations on the skin. Disorganized speech, and the person is not able to put the thoughts clearly into sentence for the other person to understand the concept, what the person is trying to say, and they might be disorganized in there, and they might actually change the subject or link one to the other in a wrong fashion. And these are called distortions or exaggerations in language and communication. Grossly disorganized behavior, as we discussed, there can be agitation, there can be catatonia, or they're just having purposeless movements, moving from one place to the other, or doing certain things that doesn't make sense even to themselves. Positive symptoms of schizophrenia. Well, schizophrenia is a disturbance that must last for 6 months or longer, including at least 1 month of delusion and hallucinations or hallucinations, and disorganized speech, grossly disorganized or catatonic behavior, and even negative symptoms that we will talk in our next video. Positive symptoms are often emphasized since they can be dramatic, can erupt suddenly when a patient decompensates into a psychotic episode. This is often called a psychotic break, as in break from reality. Positive symptoms are well known because they are dramatic, often the cause of bringing a patient to the attention of medical professionals and law enforcement, and are the major target of antipsychotic drug treatment. Thank you for watching this video. If you like this video, please press the like button, share with your friends, and subscribe the channel. There are more videos on the same and similar topics to continue with the schizophrenia, positive and negative symptoms, and how to treat them and get the help. I see you in my next video.